Hello, today let us understand a little about breast health and some of the myths that are associated with breast health. Breast health is not as commonly spoken about as breast cancer awareness, and breast health is very, very important in the overall health of a woman. Our breasts undergo a lot of changes throughout our lifetime associated with the hormonal influence through puberty, through adolescence, through adulthood, through pregnancy, lactation, menopause and after. So it is important that we are aware of the changes that our breasts go through and pay attention to the little details which will make us seek medical advice. So while it is very important to be breast cancer aware, especially in the month of October, we have a lot of scramble to get investigations done. Throughout the rest of the year, we need to be aware of the changes that our breasts go through. And some of the myths that are commonly associated as doubts which women generally come up with. So let us understand some of the questions that usually crop up during the process of talking about breast health. First and foremost, the size and the shape of the breast is predetermined genetically, and there are no creams or medications that can help alter the shape and size of the breast. Exercise, however, by improving the tone of the muscle beneath the breast, can contribute significantly to maintaining the shape of the breast. Also, the size of the breast does not impact the lactational capability of a woman. You can have very small breasts and feed your baby very well. Number 3. Tight restrictive garments, especially at night, are generally not advised. And the most important of all is that not all breast lumps are cancerous. In fact, 80% of the lumps that we see are benign or not cancer. And it's only the 20% that we need to be worried about. Therefore, it is important, no doubt, that you must have regular breast screenings. And for this, we generally talk about a 5-point code. So it's important to know what is normal for you. That's the first code. Because your breast undergoes changes through different parts of your menstrual cycle. You should know what is normal for you. Second is, you should know what you should look and feel for. So is there a lump? Is there a skin thickening? Is there a nipple discharge? You feel that one's breast has suddenly become bigger than the other. So these are things that you should know and you should look for. Then merely knowing and having that in your mind is not enough. You need to look and feel. You need to practice this regularly, at least once a month if you're menstruating, or if you've stopped your menses for some reason, mark a date in the calendar and do it on that particular day. If you do notice something which is unusual for you, immediately see a doctor and let the doctor reassure you that it is nothing to worry about. And finally, get yourself screened regularly, especially after the age of 30 and especially if you have a family history of cancer. So breast health goes beyond mere breast cancer screening. So it will affect your overall health if you do not take care of it properly. So caring for your breast involves regular self-breast examination, a physical examination by the doctor at least once a year, and depending upon your risk, the doctor may suggest that you get additional screening done in terms of an ultrasound or an mammogram. So breast health is important for your overall health, and to know more, do get in touch with us at Prameya Health. Thank you.